Hello guys and welcome back to another video. So in this video, as you have read from the caption, we are going to discuss all type of incisions that are used for periodontal surgery. And so first of all, we have horizontal and vertical incisions. So by the way, it's chapter 60, the periodontal surgical therapy from Carranza. So it's horizontal and vertical incisions we have. It's very simple as the name indicates. Horizontal is in mesial distal direction, that is in horizontal direction, and the vertical is in occlusal apical direction, and the blade 15 or 15C surgical blade is used most often to make these incisions. Now in this picture you can see the vertical incision, in which we said it is always in occluso-apical direction, so from the occlusal surface to towards the root apex. So it's this one is vertical incision, and on the right side we have horizontal incisions. Now you can see three pictures, A, B, and C. The A is internal bevel incision, the second is crevicular incision, and third is the interdental incision. Now, don't worry what these names are and what type of incision these are, because we are going to discuss all of these in detail in this video. Now, this next we have straight and scalloped incisions. This is also very simple, as the name indicates, straight and scalloped. So, our horizontal incision that follows the scalloped morphology, that is in this picture, you can see it's following the scalloped morphology of the gingiva. So, this one is the scalloped incision, and this here you can see it's following a straight line. So, this is a straight incision. Now moving ahead, we have external bevel incision. It is also called bevel incision, and it is used primarily in gingivectomy. Now gingivectomy is a procedure in which there is excision of the gingiva taking place due to any gingival hyperplasia or gingival drug-induced gingival overgrowth. We will discuss gingivectomy in a separate video in detail. And now talking about the external bevel incision, how this incision is made, in which direction it is made. So if you follow this line and then you follow, look at this picture, so it's very simple. It starts at gingiva. Of course, every incision will start at the surface of the gingiva. Apical to the pocket. Now here you can see this is the pocket, and they're saying apical to the pocket. So apical means towards the root apex. I hope you must be familiar with these terms like apical and coronal. So apical means towards the root apex, that is downward. Now in a perio you cannot say downward or upward. You have to use professional words. So it is saying apical. So apical to the pocket, that is downward from the pocket, from the gingiva, directed coronally towards the tooth. So coronally means towards the crown. Apical means towards the root apex, that is downward. Coronally means towards the crown, that is upward. So you have to move upward towards the crown, and then it says apical to the bottom of the pocket, that is downward to the pocket of the pocket, bottom of the pocket. So here it's very confusing if you read it at first, but if you follow this picture, it becomes really easy for you, that it says apical to the pocket, directed coronally towards the crown, and apical to the pocket, bottom of the pocket. And here you can see the incision is occurred, and this part of the gingiva is separated. So it's used in gingivectomy. That is the prime purpose of gingivectomy, where you are removing a surface of gingiva. Excision of the gingiva is occurring. Now, talking about another incision, that is internal bevel incision. It is also known as reverse or inverse bevel incision, and it is basic to most periodontal flap procedures. Now, we will be discussing the flap procedures in detail in other videos. Now, in this can be straight or scalloped. Now, again, if we talk about this incision, it starts at the gingival surface and directed apically towards the bone crest. So apically means downward towards the root apex, and it to the bone crest. This is very simple, and it exposes the bone. Of course, like here you can see the incision has occurred, and it is exposing the bone. So this is the internal bevel incision, and it's used most in most periodontal prep procedures. Now, three important objectives for the internal bevel incision. It removes the pocket lining. It conserves relatively uninvolved outer surface of the gingiva. And if it's apically positioned, become attached gingiva. Now we'll discuss apically displaced, undisplaced flap, all the flaps in detail in other videos, in our further videos. Now it produces a sharp, thin flap margin for adaptation to tooth morphology. Now, another incision we have crevicular incision. Now, in the book, if you read, you will find several names for it. We have crevicular, intracrevicular, cellular, intracellular, intercircular incision. Now, talking about this incision, it starts at the gingival crevice. I hope you must be familiar with this term too. Gingival crevice is the V-shaped space that is present at the gingiva, and it starts at the gingival crevice where here you can see, and it is directed apically downward, that is downward to through the junctional epithelium and the connective tissue down to the bone. So this is, you can see very clear, it's a straight incision we have just discussed now in this video. It starts at the gingival crevice down, directed apically through the junctional epithelium and connective tissue down to the bone. So this is circular epithelium. Now then we have another crystal and also known as marginal incision that starts at the surface of the gingival margin. Now here you need to know the difference between the crystal and the crevicular incision. It starts at the the gingival crevice, and this one is starting at the gingival margin. So and it's moving downward through the epithelium and the connective tissue to the bone. So this is crystal incision. And then we have the last incision, that is submarginal incision. It starts at the surface of the gingiva apical to the gingival margin. That is, here is the gingival margin, apical, that is downward to the gingival margin. And from here, it can be either external bevel incision, that is to the bottom of the to the from the apical of the bottom of the pocket. We have just discussed external bevel incision right now, or may be internal bevel incision, that is it will expose the bone. So if we are doing a flap surgery, it will be internal bevel incision, and if we are doing gingivectomy, it will be external bevel incision, which we have just discussed these both in detail. So I hope it made sense. The placement of the subgingival margin, we have to like take care of some things when we are doing the submarginal incision, and it depends on three factors: the transgingival probing depth, that is the distance from the gingival margin down to the bone, and this probing depth is used to provide a guide for the placement of the submarginal scalloped incision. And then the mucogingival junction, we have to see the keratinization, and then the depth of the palatal vault, that is the in the palate, there where there the lack of keratinized tissue is not a concern, so we place a submarginal scallop. We take into consideration the submarginal incision. Now that's
If you
it for
like this
today.
video, please hit the like button and subscribe to my YouTube channel.